Hi everyone, very good morning. We are pleased to welcome all of you to the second edition of TechBharat 2021. It's our honor to welcome the delegates and guests who are present here virtually for the day. I now call upon Mr. Srikanta Datta, the President of Lagu Udyoga Bharati Karnataka, to welcome the guests of the day. Sir, your turn to welcome. Over to you, sir.
Distinguished members, participants, and invitees, a very good morning to all of you. On behalf of Lagu Bharati Karnataka, may I extend a very warm welcome to all the distinguished guests present virtually at the second edition of Tech Bharat. Along with IMS Foundation, Lagu Udyog Bharati Karnataka, the apex organization in the service of micro and small industries, is organizing this second edition of Tech Bharat. The two-day second edition of Tech Bharat is a virtual conference cum expo focusing on two important economic sectors, the edutech and the health tech. The edutech domain covers a vast gamut of topics, including technology to elementary education, higher education, research and collaboration compliances in higher education, digital transformation in education management, education in India after the new education policy 2020, funding education on technology to healthcare, healthcare innovation, research and regulatory compliances, and the next generation healthcare, the digital transformation in healthcare, and support to startups and healthcare technology. As compared to the first edition, the second edition of Tech Bharat is being organized on a massive scale and it is being hosted in the virtual space. It will be an enlightening and a rewarding exhibition conference. The conclave is aimed at networking more than 10,000 participants representing Indian establishments to interact with the global community. Let me now focus on the outcomes of this conclave. The deliverables will include reaching the unreached audiences, enhancing brand equity of Indian organizations, aiming for larger global market share of Indian entities, enhancing the community reputation and goodwill, reaching out to global players and investors, and achieving collaboration in research and academics of foreign universities. Today, we are hosting the second day of the event, covering various topics related to edutech and health tech, and I am sure several path-breaking deliberations will come forth in today's proceedings as well. Over the next few hours from now, we will be listening to some of the best domain speakers from these two tracks, experts from India and overseas, governments, both central and state, industry captains, established and aspiring entrepreneurs, influential mentors and motivators will be sharing their valuable thoughts. I would also like to inform you that we had on December 30th, 2020, launched the Global Hackathon, which was live for 60 days. We had presented 20 plus challenge statements, which has received more than 1,700 entries. The winners of the Hackathon Challenge have all been recognized, and we will be appropriately connecting them to the investing communities to take their ideas forward. The thoughts shared in these 2 days of virtual conferences are being documented. A comprehensive compendium will be submitted to the relevant government authorities thereafter. We sincerely hope and believe the government and other related agencies will take note of these thoughts shared by the domain experts and accordingly use these inputs during the policy formations. I am very happy and delighted to share with you that many of the distinguished guests and eminent persons will be sharing their virtual presence today. I take pleasure in welcoming Dr. Harshavardhan, Honorable Union Minister for Health, Government of India, who will be delivering the keynote address. We are also pleased to have the virtual presence of Sri Tejasvi Surya, our Honorable Member of Parliament from Bangalore South. I extend a cordial welcome to him. Dr. K. Sudhakar, Honorable Minister of Medical Education, Health and Family Welfare, Government of Karnataka, has consented to share his experiences on the virtual platform. I extend a very cordial welcome to Dr. K. Sudhakar. I also welcome Sri H.V.S. Krishna, the chairman of IMS Foundation, and look forward to his views. And finally, I extend a very warm welcome to all the exhibitors, sponsors, media friends, and I would like to conclude now. And before concluding, once again, I extend a very cordial welcome to all of you for this Tech Bharat second edition. Thank you.
Thank you, Mr. Srikantadatta, for the welcome address. Up next, it is time to inaugurate the second day's proceedings of this Tech Bharat 2021. To seek blessings of Bharatamata, I now call upon Kumari Rajashri to render us the invocation song.
लम्बोदरा रत्नाम्बरधरा लम्बोदरा रत्नाम्बरधरा अम्बराधीश्वरा गौरीकुमारा अम्बराधीश्वरा गौरीकुमारा लम्बोदरा रत्नाम्बरधरा सिन्दूरवदनारविन्दा सुन्दरा सिन्दूरवदनारविन्दा सुन्दरा विघ्नाधकारा शरच्छन्दिराधीर विघ्नाधकारा शरच्छन्दिराधीर लम्बोदरा रत्नाम्बरधरा अम्बराधीश्वरा गौरीकुमारा लम्बोदरा रत्नाम्बरधरा वरपाशाङ्कुशदन्तधरा सुमोहकवरपाशाङ्कुशदन्तधरा सुमोहक शूर्पकर्णत्वच्छरण शूर्पकर्णत्वच्छरण पङ्कजकानमिपे शूर्पकर्णत्वच्छरण पङ्कजकानमिपे लम्बोदरा रत्नाम्बरधरा अम्बराधीश्वरा गौरीकुमारा लम्बोदरा रत्नाम्बरधरा रत्नाम्बरधरा रत्नाम्बरधरा.
Thank you, Rajashri. It seems all are excited and eager to move on. Thank you once again. Now it's time to digitally light the lamp. Lighting the lamp symbolizes a new vigor and sense of accomplishment in all of us. Let us invoke the blessings of Bharatamata. Once again, for your gracious presence during this lighting the lamp, I must thank each of you, the delegates and the guests present in this virtual meet. Now, as we are very much pleased to invite, let's invite our Honorable Chief Guest for the day, Dr. Harshavardhan. Dr. Harshavardhan is our Union Minister for Health and Family Welfare. He is also the Minister for Earth Sciences. May I now invite Dr. Harshavardhan for the inaugural speech. Over to you, sir.
Minister of Health and Family Welfare, Government of Karnataka, Dr. K. Sudhakar ji, my colleague in Parliament, Shri Tejasvi Surya ji, President Laghu Udyog Bharati, Shri P.S. Shrikant Datta ji, Chairman IMS Foundation, Shri H.V.S. Krishna ji, all the exhibitors, sponsors and media friends, distinguished invitees and participants. A very good morning to all of you. On behalf of the Government of India, I would like to extend warm greetings to all of you. It is indeed a great privilege for me to address this esteemed gathering of thought leaders and domain experts. I am even more delighted to note the participation of industry leaders from edutech and health tech sectors at this edition of Tech Bharat. I sincerely appreciate the organizers Lagu Udyog Bharati Karnataka and IMS Foundation for hosting this virtual event on such a massive scale. It's commendable how Lagu Udyog Bharati has been working very closely with the central and state governments to further the cause of MSMEs. Their valuable inputs on various administrative and procedural matters on a regular basis have indeed been very useful for the government during policy formulation. In today's context, the health sector is perhaps the most dynamic, especially in the aspect of formulating policies both short and long term to address current challenges expeditiously, as well as facilitating long-term structural growth while ensuring safety and compliance with due procedure. As the Health Minister of the country and as a doctor by profession, I am elated at the huge impetus provided for the health and well-being of our citizens in the recently announced Budget 2021. The massive increase of 137% in budgetary allocation for the sector will not only help strengthen our healthcare infrastructure, but will also focus on areas of preventive health and holistic well-being. The total sum allocated to the sector of more than 2.2 lakh crores will be of immense help to the country at this critical juncture in ensuring healthier lives of our citizens, while at the same time opening up enormous growth and employment opportunities. Friends, as you have all witnessed, under the visionary leadership of Prime Minister Shri Narendra Modi ji, the government has not only fulfilled its duty by providing relief to the citizens in the unprecedented times of COVID-19, but has also turned the crisis into an opportunity by embarking on a mission to establish an Atmanirbhar Bharat to further growth and development. Overall health and well-being of our citizens is crucial to build the Atmanirbhar Bharat of our dreams. In this regard, the enhanced focus on programs like Jal Jeevan Mission, the second phase of Swachh Bharat Abhiyan and the Clean Air Initiative, which strive for holistic health of our people, will help significantly reduce the disease burden of communicable diseases by curbing their transmission and preventing those caused by pollution. Similarly, the Pradhan Mantri Atmanirbhar Swasth Bharat Yojana, with a massive outlay of 64,180 crores over the next 6 years, will develop capacities of primary, secondary and tertiary care, develop institutions for detection and cure of new and emerging diseases, and strengthen the existing National Health Mission. The scheme will strengthen 17,000 rural and 11,000 urban health and wellness centers, set up integrated public health labs in all districts, 3,382 block public health units in 11 states, and establish critical care hospital blocks in 602 districts and 12 central institutions. The learnings of the country's year-long fight with COVID have helped shape the union budget. Health has been identified as one of the key pillars to drive growth in the country. The magnanimous scope in public health is not lost on anyone. Expansion of integrated health information portal to all states and UTs to connect all public health labs, operationalization of new public health units, and strengthening of existing ones at multiple points of entry in the country setting up of 15 health emergency operation centers and 2 mobile hospitals, along with the setting up of a national institution for One Health, regional research platform for WHO Southeast Asia region office, 9 biosafety level 3 laboratories and 4 regional institutes on the lines of National Institute of Virology are some of the achievements which the country can be proud of. I would also like to highlight the contribution of the Mission Poshan 2.0 scheme, which strengthens nutritional content, delivery, outreach and outcomes. This will merge supplementary nutritional programs and Poshan Abhiyan and is proposed to adopt and intensify strategy to improve nutritional outcomes across 112 aspirational districts of the country. Again, highlighting a holistic approach towards healthcare adopted by the government. Another realization which has emerged over the years and gathered momentum during the pandemic has been to go back to our roots, to opt for a system of medicine that takes care of the physical, mental and spiritual well-being of an individual. There is a need to incorporate science-backed, research-based benefits of our traditional practices of Ayurveda, Unani, Siddha in the delivery of healthcare and encourage our medical fraternity to incorporate these as part of a holistic healthcare package. The funding for the healthcare sector needs to be stepped up greatly, and it has to be ensured that there is equity in the delivery of healthcare. A radical improvement in government facilities for the poor rather than only glitzy hospitals for the well-heeled, along with the recent moves to lower prices of essential drugs and health equipment are steps in the right direction. There is a huge scope for the private sector to play in the health sector. Innovators and tech entrepreneurs all over the world are increasingly shifting their focus towards this sector. We can proudly say that there is no dearth of talent or ideas within the country in this regard. Our scientists, startups, innovators are second to none in terms of capabilities. They are backed by a government which is not only committed to help nurture their ideas and talents, but also help serve as a bridge between them and investors in order to help them realize their full potential while also serving society. Before I conclude, I would like to share that my vision for India 2022 cannot but be the one visualized by our beloved Prime Minister Shri Narendra Modi ji. We have to work in unison to actualize his dream of a strong, flourishing nation that is at the forefront of the Committee of Nations by 2020. To arrive at the destination, New India, a lot needs to be done. But if every citizen lends his shoulder to the wheel, the goal should be well within our reach. I once again wholeheartedly thank the TechBharat organizers for providing me the opportunity to share my thoughts with the gathering of luminaries present here today. Thank you. Have a good day.
So, thank you for accepting our invitation in spite of your busy schedule to inaugurate Day 2 proceedings of the Tech Bharat 2021. Indeed, your remarkable work being the Union Minister for Health and Family Welfare is highly appreciated and applauded by one and all during this COVID-19. Thank you once again, sir. Well, it is time to invite our guest of honor who represents Government of Karnataka on this occasion. It is Dr. Sudhakar. Dr. Sudhakar is the Honorable Minister for Health and Family Welfare, Medical Education in the state of Karnataka. Sir, I now invite you to address the gathering virtually. Over to you, sir.
A very good morning to all of you. On behalf of the Government of Karnataka and my own behalf, I extend a warm welcome to all the participants present on this virtual platform. I need to stress the fact here that Lagu Udyog Bharati Karnataka has been working very closely with the state government by providing valuable inputs on industry with specific reference to MSME sector on a regular basis. This is helping the state government in the policy formulation process immensely, as the policy is now being designed in tune with the industry requirement so that it progresses on a rapid scale in Karnataka. Friends, from the time we have assumed office, our focus has been on meeting the expectation of the people of our state. Several path-breaking policy initiatives have been announced by our government, the prominent being the new industrial policy 2020 to 2025, which we are sure will take Karnataka to the next level of industrial revolution in the state. Our government continues to believe that inclusive, equitable and sustainable growth is the only way forward to attract more investments into the state. Today, Karnataka's gross domestic product is about US dollar about 258 billion at current prices and is growing at a comfortable pace year on year. This growth rate is perhaps the highest growth rate in India. But it is not enough. A new industrial policy for fiscal band of 2020 to 25 has been released, and this aims for an annual growth rate of more than 12% and attract investments of rupees 5 lakhs crore, providing employment to about 15 lakh persons during the period of the policy. This is the growth rate that we aspire for. This is the growth rate which will help us achieve our vision within a reasonable time frame. Talking about today's TechBharat, the flagship event jointly hosted by Lagu Udyog Bharati and IMS Foundation. I am proud to say that Government of Karnataka is associated with this event, and such events basically which showcase Karnataka's abilities and competencies to the outside world. These kind of events hugely build brand equity for faster growth of Karnataka's economy. It is needless to say that Karnataka has made tremendous effort in improving the health status of its people in the last few decades. The state has made substantial progress in building credible healthcare infrastructure with a wide institutional network providing health services both in urban and rural areas. To achieve the target of making healthcare more inclusive and cost-effective, Karnataka has been using information technology effectively. The state has also been a pioneer in government-supported health insurance schemes such as Yashaswini and Vajpayee Arogyashri, which were among the first of their kind initiatives in India. With a clear objective of taking equality healthcare to the doorsteps of the citizens, Karnataka has been transforming its healthcare sector with a proactive approach. We are among the few pioneering Indian states with a strong track record in the formulation of health policies. The Karnataka State Integrated Health Policy was put in place in 2003 to address the specific healthcare needs of the state, recognizing regional disparities to provide more specific planning. The state has also been a pioneer in government-supported health insurance schemes. Following a pragmatic approach to policy formulation, the health indicators improved significantly in the state as the government increasingly focused on people-oriented development of health services with strong emphasis on process and implementation. Among the largest states of India, Karnataka has one of the lowest infant mortality rate at 24 per 1000 live births. The percentage of births in a health facility has increased dramatically in the last one decade from 65% in 2010 to 94% as of now. Karnataka also became the first Indian state to have rolled out a universal health coverage scheme. The about 60 million population of the state is covered under the Arogya Bhagyashree scheme by merging existing health schemes under a single umbrella. Having introduced a number of CSR initiatives, PPP models in healthcare system, telemedicine system in PHCs, teleradiology, e-hospital, e-arogya, PHC, MIS projects, virtual clinics, mobile medical units, among others, the government is providing a new direction to the sector that relies on the bottom up approach to further improve the health indicators of the state. Upgrading health related infrastructure and human resources in public health facilities in Karnataka are among the top priorities of the state. In 2018, Karnataka came up with Arogya Karnataka Yojana to ensure that medications are accessible to each one in the state. As far the technology adoption is concerned, digital healthcare is expanding fast in Karnataka. The primary healthcare system, the management information system, is an excellent initiative started by the state government to make it available real-time information on patient treatment, diagnosis, deliveries handled, and drug availability, etc. and etc. We strongly believe that it is important that decentralized health planning is done properly in the right spirit. Under National Health Mission, Karnataka has been preparing district health action plans with a bottom-up approach. It involves the data collected by ASHA workers through a house-to-house survey. The plan is vetted by all the program managers above district level, and based on that, the state program implementation plan is prepared and sent to the Government of India. The state under NHM has embraced IT just like private sector. The state has a number of software pertaining to various programs. For example, the mother and child tracking system, health management information system, ASHA software, integrated diseases surveillance system, software, etc. Karnataka has been working on health reforms for quite some time. Among some of the reforms adopted in the state include implementation of virtual clinics to facilitate the access, availability and affordability of primary health care to people in remote areas, C&R with rationalization of available human resources, and streamlining of human resource management systems, among others. To sum up, there are vast opportunities for investment in healthcare infrastructure in both urban and rural Karnataka. Determined to provide a world-class healthcare infrastructure in the state, the Karnataka government has been making efforts to make quality healthcare available to the citizens by leveraging technological innovations. As these interventions are set to change the course of healthcare sector in the state, it is widely hoped that the state will emerge as a role model to follow by other states in India. May I once again take this opportunity to extend my heartfelt thanks to Lagu Udyog Bharati, TechBharat, also to all the distinguished invitees and participants present here in such large numbers. Thank you.
Indeed, right since our first pre-event of TechBharat 2021, we are happy to have got the full support of the government of Karnataka. Again, your leadership during this period of COVID-19 is highly commendable. Your presence has made the required difference, inspired all of us. Thank you for your continued support and assurance of the Government of Karnataka in promoting health innovation and health infrastructure in the state. Thank you, sir. Moving on, it's time to hear from our young and dynamic parliamentarian, our Honorable Member of Parliament from Bangalore South, and a youth icon, Mr. Tejasvi Surya. For his vibrant speech, may I now invite Mr. Tejasvi Surya to address us in this virtual meet.
Namaste. I want to, at the very outset, thank all the office bearers of Laghu Udyog Bharati for giving me this opportunity to interact with all of you and be a part of this very important summit. Laghu Udyog Bharati, like all of us are aware, has been doing phenomenal work amongst especially the MSME sector in the country, and they have played a very important role in policy formulation and also being an important platform for discussion between policymakers and various stakeholders of the industry. Even in the recent past, I have had the opportunity of interacting with a lot of office bearers of Laghu Udyog Bharati, all of whom I must say are extremely dedicated and very deeply involved with all the issues concerning the industry. At every point of time that we have interacted, they have always given very important feedback from the different stakeholders. Many of these feedbacks which the LUB has been giving to the government at various levels has also found resonance in policy formulation, including very important formulations regarding the labor code, the code on wages, and many important announcements in the recent budget as well. In that regard, I am extremely happy about my association with LUB, and I wish the organization only the very best in the years to come. Friends, I am extremely happy to know that this year's summit has two very important and very relevant tracks, that being education and healthcare. Both these important tracks are extremely important in the context of India's growth story. Like all of us are aware, India is a young country. A young country with a large demography like India offers innumerable opportunities in every sector. Education is a critical component of equipping our human resource to meet the challenges of the 21st century. The world is rapidly changing. Technological evolution taking place all across the world is changing the way we live, the way we perceive things, and the way we understand the world in such a fast pace that the pace of change is unprecedented. What is new technology today becomes old technology tomorrow. There is a need to even revisit Moore's law in terms of understanding the pace at which technological progress is happening. Technology in education will play a very, very important role in not only ensuring access to everybody, but also making education accessible and affordable to people. The fact that we have before us a challenge of not only giving literacy to a large section of the population, but also equipping them with skills that are needed for future jobs is also very important. The nature of jobs is changing, which will mean that the nature of education also must change. The education system that all of us are witnessing today, the one that we see today, is a product of the industrial revolution of the 18th and 19th century. This, however, will not suffice to address the challenges of the 21st and 22nd century. Therefore, the education system as a whole must need a rethink. And technology will play a very important role. Edu-tech will play a very important role in not only dissemination of education, but revisiting the concept of learning and teaching itself. We have seen during the COVID pandemic how though schools were stopped, learning did not stop. So education based on technology and education based on new ideas, new innovation will have and play a very important role in the coming years. And I am very happy that LUB has given importance to EduTech in this important summit. I am sure that new partnerships that will be forged, new ideas that will be discussed in today's summit will play a very important role in not only disseminating these ideas but also contributing to catalyzing change in this sector. The second important sector that has been addressed in this summit is the healthcare sector. The Prime Minister, very rightly, in his wisdom, has allocated the highest budget ever in India's independent history to healthcare and well-being of Indians in this year's budget. This year's budget also makes a very important change insofar as understanding healthcare in a very holistic manner is concerned. Healthcare cannot be addressed in silos, but healthcare and well-being of people, whether it is clean water, whether it is clean air, whether it is preventive healthcare infrastructure, all of this makes a very important contribution, significant contribution to making a healthy society. So in that regard, healthcare is going to make is a very important sector of the economy which will witness near double-digit growth in the coming decades. The fact that the national health policy of 2017, as well as the thrust that has been consecutively given to healthcare by this government in the last so many years, whether it is the Ayushman Bharat Yojana, whether it is the increased outlay to create primary healthcare infrastructure, secondary healthcare infrastructure, and also most importantly, almost double the number of students, doctors who come out of this country's colleges. The number of medical seats that this government has increased in the last 6 years is more than the number of seats that any government in 5 years has done earlier. So the thrust that has been given to healthcare is unprecedented. The National Digital Health Mission is also a very important step in this direction. It is going to give a paradigm shift to the way a common Indian citizen will interact with public health delivery services in the country. Just like how One Nation, One Ration card has enabled a migrant labor, say living in Bangalore, who has part of his family living in Uttar Pradesh or Orissa, get a portion of the ration here in Bangalore while the rest of his family gets the rest of the portion in Odisha or is in his hometown. The National Digital Health Mission will also help and empower every single Indian to monitor, track his health data, get health benefits from across wherever he is living in whichever part of the country. So these monumental steps that we have taken is going to change the way India's public health service sector is going to be seen. The fact that we already are the pharmacy of the world is only going to give more thrust. Cities like Bangalore are already attracting medical tourism from around the world. This in the coming days is going to increase. All of these only present us with a very rosy picture of how both education as well as health are two important sectors in the economy which are going to be the engines of growth, if we can so call them, in terms of giving fillip and boost to India's economy. It is very heartening to note that Laghu Udyog Bharati Summit is making a very strident progress in this regard by addressing issues of these two sectors, bringing together experts from these sectors, achieving collaboration between these experts, and creating a platform that is very necessary for future leap and growth. I thank Laghu Udyog Bharati for organizing this very important summit, and thank them again for giving me this opportunity for addressing all of you and interacting with all of you. We hope that with the fast-paced rollout of the vaccination process, which is undergoing, the next edition will perhaps be a physical summit where all of us can shake hands and be with each other physically present in the event. Until then, I wish all of you the very best. Take care and stay safe. Bharat Mata ki Jai. Namaskar.
Thank you, Mr. Tejasvi Surya. I know, in spite of your busy schedule, you made it a point to be a part of this second edition too. We are moved by your thoughts and look forward to more and more of your actions being the true icon of youth in India. Thank you once again. Well, we have come to the closure of this morning's event. Time to give away our thanks to all the guests and participants who are here virtually. May I now call upon the executive member of Laghu Udyoga Bharati Karnataka, Mr. Sunil Maheshwari, for the word of thanks. Over to you, Mr. Sunil.
Namaste all. Dear Dr. Harshvardhan, Honorable Union Minister for Health, Government of India, Shri Tejasvi Surya, Honorable Member of Parliament, Dr. K. Sudhakar, Honorable Minister of Medical Education Department, Health and Family Welfare Department, Government of Karnataka, Shri H.P.S. Krishna, Chairman IMS Foundation, Shri P.S. Srikant Datta, President LUB Karnataka, all our exhibitors, sponsors, and media friends, distinguished members, participants, and invitees. A very good morning to all of you. On behalf of Laghu Udyog Bharati Karnataka chapter, may I extend a very warm welcome to all the distinguished guests present at this important virtual conference. It is always a great feeling to see such a large gathering of government officials from both state and central government. Corporate captains, thought leaders, domain experts from education and healthcare participants in this webcast session. Talking about TechBharat 2021, the flagship event jointly hosted by Laghu Udyog Bharati and IMS Foundation. I'm proud to say that along with Government of India and Government of Karnataka, several education and healthcare institutions, corporates are associated with this event. And such events basically showcase the prowess of the state's abilities and capabilities to the outside world. It is indeed a pleasant task for me to propose a hearty vote of thanks to our chief guest, Dr. Harshvardhan, Honorable Union Minister for Health, Government of India, Shri Tejasvi Surya, Honorable Member of Parliament, and Dr. K. Sudhakar, Honorable Minister of Medical Education Department, Government of Karnataka. We are really proud to have such leading luminaries addressing us and sharing their visionary thoughts for the common good of the nation. My special thanks to Hackathon mentors, Dr. S. Ravishankar, Principal BMS College of Engineering, Mr. Chandramouli, CTO, Sankara Netralaya, and Dr. Sudhindra Kaushik, Chief Innovator, Prasu, who are the principal architects of the global hackathon concept. At the outset, we would like to take this opportunity to assure that Laghu Udyog Bharati Karnataka will continue to cooperate and partner with the state and central governments, and also private sectors on improving overall business environment. We look forward to all stakeholders' help and guidance in making this partnership fruitful for the benefit of industry and overall economy of our nation. My personal thanks to all our speakers, exhibitors, and sponsors who have so graciously accepted our invitation to participate in this virtual conference. Once again, I thank each one of you present in this virtual conference and look forward to the collaborating in all our future endeavors. Thanking you.
Thank you, Mr. Sunil. On behalf of the organizing committee of TechBharat 2021, we once again thank all the audience present here in this virtual meet. We look forward to your continued participation for 9 more panel discussions of the day, happening in 2 different streams, health tech and edutech. Well, all of you from TechBharat, we are wishing you a very good day ahead See you in our next virtual sessions. Once again, happy morning to all.